everybody, and welcome to another episode of Public Opinion with Pam and Vanetta. And hi, Vanetta, how are you?
Good afternoon.
Hello, and good afternoon. Public Opinion is the current event discussion and debate show that gives participants the opportunity to defend and discuss their opinion in response to the public opinion question of the week. And this week, Vanetta, I'm excited because I'm actually going to have 3 participants who were past guests on the show to come back and talk about the vaccine and why they have changed their mind and why they are now going to get the vaccine or why they have gotten the vaccine. Because when they were on the past shows, they had either said flat out, no, I'm not, or I'm going to have to wait, or I just don't know because we just don't know enough about it. So, I think it's important to have people who have changed their minds come back and say why they changed their mind. Now, have you gotten the vaccine?
Yes. Now, I was always good for a vaccine. I got my first and second one. I get a flu vaccine every year, and I come from a nature of vaccines because I worked for the March of Dimes, and that's where the polio vaccine was created. So I know the good that a vaccine can do. It can eradicate a disease. So I was confident in it. I was a little more hesitant for my younger children, but my side effects were minimal. I actually get much sicker with the flu vaccine.
Oh, really? Now, what vaccine did you get?
I had the Pfizer vaccine.
Okay.
And the first shot I had.
Fully vaccinated then?
I'm fully vaccinated, okay. Right. 3 weeks later, I got the second one. The first shot, I had no reaction to it whatsoever. Okay. And my husband's arm was a little sore. That was what he had. And then the second vaccine, my husband felt flu-like a little bit. I was good the first day. The second day, halfway through, I got so tired I couldn't keep my eyes open.
Okay.
It was worth it.
That's good to know, because I think that's one of the hesitancies that a lot of people have is the side effects and a lot of other things. I was one of those people who was hesitant, but I'm happy to report that I have changed my mind and I will be getting the vaccine. I'm actually scheduled to get it next week. So
prayer works.
Yes, prayer works. And you know what? You actually were in the minority of people originally who were saying that they would get it, but 61% now of Black Americans say that they plan to either get vaccinated or have already been vaccinated. So that's good news.
It is good news.
It is. So at any rate, let's get started and meet our participants for this week. First, we have Monique Patterson-Ceasor. And Monique is an instruction and assessment specialist. Then we have Tonya Horn. Tonya is a diversity and inclusion manager. And then we have Clarence McElarth. And Clarence is a grants and contracts administrator. And then we're also going to have a very special medical guest. And we are going to have Woodrow McWilliams MD. Dr. McWilliams is a radiation oncologist at John B. Amos Cancer Center in Columbus, Georgia. Let's welcome our participants. Okay, and welcome to Public Opinion. Thank you all so much for agreeing to return to the show. And I'm excited to know why you all changed your mind and for you all just to have the opportunity to speak to the community, because a lot of people might be feeling the same way that you all have felt, and they may need to know why they should change their mind and have other people who actually also experience the same thing. So we're going to get started and see the public opinion question for the week. All right, the public opinion question is, why did you now decide to get the COVID-19 vaccine? All right, so the way I'm going to do this is I'm going to give each one of you the opportunity to answer that question and give you a couple of minutes to answer the question. But before you answer it, I'm going to remind you of a quote from the last time you were on the show, because the last time you were on the show, I asked each one of you whether or not you would be willing to get the vaccine. So we're going to start with Monique. Now, Monique, when you were on the show on December the 19th, and I believe that was when the vaccine had first come out, you said, I'm not ready for the vaccine. It was created too soon. So we're going to hear from you now. I'm going to give you a couple of minutes And you can answer that question now.
When we spoke in December, I was not ready. To be quite transparent, when I got the vaccine recently, I was still a little apprehensive. But I had enough experiences where I have a group of friends that I talk to on a regular basis that are physicians and nurses. They have received both the first and second vaccines, and they were fine. They had some of them did have side effects, but they were minimal. I don't know how many different webinars and podcasts I had attended from December until I got my vaccine. And it was swaying in the direction that it was safe. Also, I started to think about my quality of life if I decided not to take the vaccine, the restrictions I would have about where I could travel, what I could do with my children, where I could go eat. And with all of those factors combined, I said at this point, I'm just going to pray about it and I'm going to do it. So I took the first vaccine about 3 weeks ago. And I had some tiredness that lasted a couple days and some pain at the injection site. Just last week, I got the second vaccination, and I didn't have any side effects at all with the exception of a mild headache on the first day. So I am prepared to be sick because you hear all these horror stories. So I had my dresser all ready. I had Tylenol, I had water, I cleared my schedule. I won't be able to do anything the next day. And my son and my husband kept coming upstairs checking on me. You okay? Let me feel your head. Can you move? And we were waiting for the axe to drop, and it never did. So I'm fine with it, in addition to the fact that I was able to do it along with my coworkers. So it wasn't an experience that I had by myself. So I had an experience that was a group experience, and I was able to talk to people that were going through the same experience at the same time. So yes, I did have the vaccine.
Okay, thank you so much for that. And now we're gonna hear from Tonya, but Tonya, before you answer, when you were on the show, and you also were on the show December the 19th, you stated, when asked whether or not you were going to get the vaccine, you said that you did plan to take the vaccine, but you wanted to wait to see what happens first, maybe what happens to other people or just what happens in general, and then you would decide. So I'm going to let you answer and state why you have now decided to get the vaccine. And you can go ahead.
Okay, thanks, Pam. So, right, when I was on the show on December 19th, I did say that I would wait. And I kind of knew that by the time my turn to take the vaccine would come, it would probably be months after the first vaccines were given to the public. And so December 19th, we were talking about it. I still have not taken the vaccine. I plan to take it hopefully next Friday. And so it's been at least 3 months. And so I've, hearing the news about it, hearing conversations around it, I always knew that I was going to. I just wasn't eager to take it, the first person out of the gate, I should say. And so, like Monique said, I really worried about my health in terms of what would happen if I didn't. During this whole pandemic, I was always concerned if I were to get COVID-19, how would my body respond? Because I do have an underlying condition, medical condition. So I was really nervous about even contracting COVID-19. So for me, I felt like I have to get it because I just don't know that, if I would survive it, if I got COVID-19 or not. So I'm glad when they released the vaccine for my age group, I immediately that day, I went online to try to sign up with Epic Fail. But in discussion with a lot of different people, just word of mouth, people found out that I had the trouble of trying to get the vaccine, and at least 3 agencies or 3 people contacted me with some agencies to help me secure a spot for the vaccine. So I'm hoping on next Friday, I will be able to get it.
All right. All right. So now Clarence, you were on the show actually November the 15th. And at that time, the vaccine hadn't even come out yet. But at that time, when asked whether or not you would get the vaccine, you stated, short answer, no. You stated that you don't know what's in it and that you were not in any hurry to get it and that you did not trust it. So I can't wait to hear why you have changed your mind. All right, go ahead.
It's simple. When when we first got the news that there was a vaccine, I thought, being the conspiracy theorist myself, thinking that this is a political trick. This is a trick by the government. Yeah, we have a vaccine and everybody take it, which would sway the election. So, that's the first thing that I thought. And I said, well, everybody's going to line up and get these vaccines, and they probably won't do anything, and everybody will still get COVID. So, I mean, that was a uneducated thought process. But, just the first thing that popped in my head. And then also, the side effects, I thought about that. I do have underlying conditions. And then the first, I'm going to say maybe a couple weeks after the vaccine came out, I saw something on the internet, and you can't believe what's on the internet, but I did see it where this woman had, she got Bell's palsy and her face was all twisted, and that's real close to a stroke. Now, I kept hearing, oh, well, she's a nurse and, she got it and blah, blah, blah. So it kind of threw me off. And so I'm going to say all the way through the beginning of the year, I was still, no way, I'm on wait. And because I work for the Cleveland Clinic, as soon as it was available, there an email pops up and says, hey, you can schedule it. And I think they were nudging management to get it as soon as possible. I just stayed in the background and waited. So I'm gonna say over the last month, since it's been really going, I've talked to a lot of people. I think I know 25 people who've had both shots, and probably 30 with 5 more that are waiting for their second one. So I'm just watching the side effects, and most people, again, like has already been said, that got mild symptoms. I talked to a person the other day, a couple of days ago, and she said, well, when I got my first shot, I had all the symptoms. I just thought they gave me COVID, but after 24 hours, a few Tylenols, I was fine. So, that kind of made me ready to really look into it. So then I talked to some professionals about, well, the reason why it's called COVID-19 is because there are a lot of different iterations of this this virus. So they've already been working on it, and that's the information that I received. They've been working on some type of, they just had to change one thing, drop in 2 droplets of this, I don't know, add some baking soda, whatever they could do to make it fit whatever whatever this particular iteration is.
All right. Thank you so much.
Wait a minute, I ain't finished now.
Okay, I'm like, now, are you the medical expert or what? Not only did you change your mind, but you've become quite the expert on COVID-19.
No, I'm not going to say expert, but I did some research because, again, there's only a couple of ways this could happen. Could work. You get really sick from taking it, or you could, or nothing could happen. It could not.
I think that's the scary thing about this.
Sure.
And I'm sure everybody has kind of done their own independent armchair research or Google research or whatever, because it's just such a random type of a illness, and that's what makes it so scary. For some people, they have such mild symptoms and just lose their sense of taste and smell. Other people end up on ventilators in the hospital, and unfortunately, other people have passed away. So I think that's why it's such an unknown thing. And then again, Monique, you said you're all done. Now, how many people do you know who had the vaccine already? And did that also help change your mind? I know you said that you talked to other people and some other people went with you to it. So do you think that was one of the biggest factors that changed your mind?
The fact that the people that I knew that got both vaccines were very close friends. So it was no time in between them getting the first vaccine and the second that I didn't have a conversation with them on a regular basis. So if something would have happened between the first and second vaccine, I would have known because I talked to them sometimes daily, sometimes weekly. So to be able to see them be able to live a normal life and have no side effects that changed the quality of life, it made me feel much more comfortable. And to add to the fact that they are nurses and doctors, so they are professionals, not just my friends. So I trusted their response to the vaccine. And then when we first got the opportunity as educators to fill out the paperwork to get the vaccine, I waited until the very last minute. So it had to be turned in by 3 o'clock. I think I turned mine in at 2:59. So, I was sweating all day, going back and forth, calling people, texting people, asking their opinion. Then I said, okay, I can go ahead and fill this paperwork out. And if I change my mind, I just change my mind. I'd rather have it and not need it than need it and not have it. So I went ahead and filled it out. When the appointment was confirmed, I still confirmed with other people, did you get your appointment? How do you feel? And when we went as educators, it was done at the Educational Service Center, and you went with your entire school district for whoever said yes. So you weren't in a group of 5 or 10 people, it would be your entire school district, and they had it as a well-oiled machine. We were in, we had our paperwork. The most time I spent was the 15 minutes that you have to spend after you get the vaccination to make sure that you're fine. So I was in and out of the process, maybe 7 minutes, and then 15 minutes to wait. And again, I was there with a group of people that I knew and saw not one person that had an adverse effect or adverse effects in front of me.
That's really good to know. Vanetta, you didn't have any side effects either, really, other than what you
No,
said.
I consider myself very fortunate. When I had the flu vaccine, it was far worse. And as she said, it was a well-oiled machine. Actually, when I came out from my vaccine, they had someone playing the violin, and I found myself staying 30 minutes versus the 15. It was so enchanting, the music.
And then Tonya, did you have any trouble getting an appointment to get the vaccine?
Yeah, so the first day that they opened it up for my age group, I went right onto the website, and I know that downtown at the Wolfstein Center was probably the most popular spot. I could not get any appointments. And then I started searching different other locations like CVS and Walgreens. I could not get anything. So I was so frustrated because you had to go through a process of answering a lot of questions. You needed some sites, you needed a social security number, you needed your medical ID number. I mean, it was just crazy. All of that I had to go search for, put it in, and then they tell me we don't have any availability. So I was frustrated. They should tell you if you have availability first before you go through all of those questions. So I still don't have it. Through the grapevine, well, actually, one of my friends, I asked her, has she had it yet? And she said she did. And I said, I haven't gotten mine yet. And so she ended up telling me that my city councilwoman here in Cleveland Heights has access to give out to over 200 citizens in Cleveland Heights. So I got on the phone and I called my city councilwoman and I said, I need a vaccine. And so she says, I got you. And so then she called me the next day and said, guess what? We're going to have a center in Cleveland Heights. So I won't have to go down to Wolfstein. So I was like, well, that's great. And so they're still working everything out. And then hopefully by next Friday, I will be able to go and get my vaccine. And, you know, I helped my dad through this process. He is 79. Yeah. He lives in Cincinnati. Yeah. It was crazy trying to get him signed up too. Finally, after a couple of weeks, we were able to get him signed up and he had no side effects at all. I called him the next day after the second vaccination. I said, okay, be prepared, Daddy, that you're going to have some side effects. So make sure you get rest or whatever. He had none.
Okay, wonderful. Well, I want to definitely bring in our medical expert to answer questions about the vaccine so that people can feel a little bit more comfortable and get a little bit more information. So if you all would like to stay and listen to him, you are more than welcome. So we are going to introduce our medical expert, Dr. Woodrow McWilliams. And Dr. McWilliams is a radiation oncologist at John Amos Cancer Center in Columbus, Georgia. So let's welcome him. All right, and welcome, Dr. McWilliams. And thank you again so much for agreeing to join us on the show. And Vanetta and I have a couple of questions for you. And if our participants, after we get finished asking you questions, have any questions, they certainly can ask as well. Okay. So Vanetta, you want to go ahead and get started?
Yes. Hello, doctor. So glad to have you here today. Now, my question is, should we be concerned with how fast they created this vaccine?
That's a very good question. What's actually kind of interesting is that the technology for developing the vaccine is not new. They've been doing this for many years previously. The vaccine was developed quickly to a particular virus that was novel. But the technology they've been estimating, they've been looking at it for decades, specifically for the Moderna and Pfizer vaccines using the mRNA type vaccine. And so it wasn't really the technique or the technology that's new, just the target was new. And so remember that a lot of clinical research they make it a point to make sure they protect subjects who are involved in that, because they learn from the horrific mistakes of Tuskegee. And even Nuremberg with the Nazis. And so they make sure they do everything possible to protect subjects and patients, and thoroughly study any type of drug that is, that's being developed for usage in the general population. If you look at drug testing, they have 4 phases for it. Phase 1 usually is to test, number 1 is safety. Phase 2 is efficacy. Phase 3, I think of it as reproducibility, meaning that can you, once you demonstrated some efficacy of the drug, you then test it to see if you can reproduce it in multiple populations and sometimes across multiple institutions. And phase 4 can be things such as marketing. And so that's why a lot of us watch this play out in real time. We're in phase 1, 2, and 3. 3 was when they started to really talk up the vaccines. And so it really showed us that something was very effective and also safe.
Thank you. Excellent.
Yeah. Now, what about the side effects?
That's a great question. Side effects are pretty similar to what people might get with any other vaccination. The most common ones I hear people tell me about are maybe soreness in the arm or the injection site and tiredness. Some people can get in the first 24 to 48 hours, maybe a fever. And what that is, of course, doctors may say, oh, that's good because, that means your body's developing a reaction, an immune reaction to try to get ready to fight the infection. But of course, it may not feel very good to someone, but we have to use that as reassurance. So, maybe a low-grade fever, soreness at the injection site, and tiredness are the most common ones that I hear. Now, of course, you may hear of these rare instances, extremely rare instances of people having a severe reaction to it. But the safety of the vaccine has actually been very impressive.
Okay. Now, how exactly does the vaccine work and what is it made out of?
Okay, that's another good question. So I'll keep it general. The Pfizer Moderna vaccines are made out of basically an mRNA. mRNA stands for messenger ribonucleic acid. And I'm taking us back to our high school biology. We know that our blueprint for all living things essentially is DNA. It's the genetic code. RNA, I think of it as like a working copy of the DNA, because the DNA is very precious. And so when the cell makes DNA, needs to send out a message to code to make the proteins that make the cell work, that give it its specific characteristics. It creates a strand of working copy of the RNA called messenger RNA. And that basically is what is the basis of the Pfizer and Moderna vaccines. What it does is that it actually is a little piece of code that is injected into the body and actually teaches the body to make this protein, and specifically a protein that identifies it's something unique to the coronavirus, so that the body will start making antibodies to it. where we normally, some of your classic vaccines, they'll use a virus that's been like for flu vaccine, they kill it. So this, very unlikely to cause an infection. But that protein, which is the marker or the switch on the outside of that cell that identifies it, in a general way, the body develops antibodies to it. And so that if someone gets an infection, usually it's it's difficult for them to get an infection, or they have a very I would say benign course, but not a very severe infection from it, or a shorter course. And so what the mRNA does, basically, instead of putting a virus into someone, it's just putting a little code in it. That's why if you heard in the news, they say it's impossible to get COVID from the Pfizer and Moderna vaccines, because you're not putting the actual pathogen, healthy or killed or otherwise, into the body. And that's why it's a very novel thing. If you notice, a lot of physicians and scientists are very excited about it, because they've been looking at this as a possibility for years. You have to think about it, working on this level with genetics, essentially, is something we probably could not do and mass produce with the technology that we had 30 to 40 years ago. And so that's how the Pfizer and Moderna vaccines work. The other ones, like the Johnson & Johnson and the AstraZeneca, actually use a vector, and that's basically a biologic agent, which is an adenovirus that does a similar thing. The adenovirus doesn't cause an infection, but what it does is kind of a shuttle to put that protein, to sensitize, to teach the cells how to fight, the immune system basically how to fight against it. But instead of just using it through the mRNA, it uses it through an adenovirus, or adenovirus, how you would pronounce it. And that's a virus that doesn't set up an infection. That's one of the reasons why, if you look at the Johnson & Johnson vaccines and the AstraZeneca, a lot of public health officials are very excited about those vaccines, because it doesn't require the same temperature to keep it cold to process it. So you can take that out to a rural area and give it to patients who don't have access to a freezer that's -70 below. The mRNA vaccines are very sensitive, and so they're not as tough. So again, it's nice to have a wide range.
I appreciate that. Now, a trusted source here told me a little baking soda went into it. Is that possibly true?
Baking soda?
That's what he said.
I'm not familiar with that one. Okay.
I didn't think it was true. I just wanted to check.
I have another question. Can you achieve herd immunity without the vaccine?
That is a great question, and is one that was, I think, I hate to even introduce this, but was part of a very political debate amongst a lot of people. And the challenge with herd immunity of just letting the virus run its course, thankfully, most people that get coronavirus don't die from it. However, it's still a pretty significant death rate. If you're looking at, in some of our toughest times, at one point we were almost at, 5% death rate, which doesn't sound like a lot, but that's a lot of people. Now it's probably, it's below 2%, but that's still quite a few people. We look and see that over 530,000 people have died from this virus. That's a significant amount of people. I don't know if you remember when, in the beginning, where many folks who were of a different political party said, oh, it's just like the flu. No, it's not. And so one of the challenges is that to do the herd immunity, if you just let it run its course, some of your public health officials said they would have had death estimates to probably between 1 and 3 million people in some cases. That's a very huge cost on society, and I don't think anyone is expendable. And I think it sounds kind of callous when we say that. The other thing that's a problem with COVID-19 is that we always focus on the infection and death rate. The problem is 10% of people have long-term morbidities from it, meaning that they can have issues with their heart, their lungs. I have a close friend of mine actually here locally who is a young woman, 47 years of age, not a whole lot of medical issues, and now has an enlarged heart after her COVID infection. She's still alive, but she still has to use supplemental oxygen, and it's been 3 months since she had it. So that's where you talk about the long haulers. So again, trying to achieve the herd immunity by just letting the virus run its course can be very dangerous. The other challenge that we have been seeing, if you notice, many of the guidelines suggest that after someone has had COVID-19, they say that you can kind of, look for within 3 months that you may not have to get tested as quickly if you're around somebody exposed. But if you notice, they keep talking about the 90 days. The reason being, I mentioned to you before, one of the things we measure to see if someone is immune is antibody titers. And antibodies are just proteins that help us fight infection. But what happens after about 3 months, they've been seeing some of those numbers or antibody titers or levels, they start to drop off. And so that's why it is possible for someone to get COVID and develop an infection again. And what's funny, early in the pandemic, I had a patient who had it in March. She was in Chicago, relocated to Georgia. I took care of her in June, and she got infected again. I've had someone else here recently, a member of my family's church, had COVID in the summer. 8 months later, she's got it again. And so it's challenging to see if we would say herd immunity. The other thing that people were not talking about, and I was asking this question, is that, you know, you hear everyone's talking about variants right now. Well, the challenge is that, you know, you're dealing with a virus, a viral variant. Every time the virus, you know, travels to person, it turns over and it can mutate. And so when it mutates, one might be more contagious. You know, we don't know if some of these variants might be, of course, some of them they say have not been more deadly, but then there have been a few of them that they're thinking could be or have more issues with it. So it's just very difficult to let this run this course and feel secure that once 65 to 85% of the population gets it, that it's going to actually just peter out, is what I've heard some people say before, because you just don't know, because people can get reinfected with it. Not to mention that it's going to be quite dangerous and a significant toll on the population. So we definitely recommend the vaccine. We're not totally sure how long the immunity, they're still studying that with the vaccines last, but it does seem to be longer than the 3 months that you get just with having a natural COVID infection.
Okay, doctor, my last question. What can I do once I'm fully vaccinated?
That's a very good question. We've seen a lot of touching videos here on the news with grandparents reuniting with grandchildren. And the CDC has, you know, the CDC has been in my thoughts and prayers during this whole situation, because, you know, you're having to study a virus that moves faster than you can do research. And then you're trying to give information to the general public so that you can, so to speak, hang your hat on and trust. Well, you need to have data to do that. But the other problem with that is that then you had conflicting people in leadership who were saying the opposite of what you were putting out. And so now all of them are breathing a sigh of relief, I believe, because now they can really put out information. So now, you know, what's changed is that patients or people who have been fully vaccinated now, of course, that means 2 weeks after being given the 2 shots from the Moderna and Pfizer, and of course, 2 weeks after the single shot of the patients who had the Johnson & Johnson, okay? You can gather indoors now with fully vaccinated people without wearing a mask. You can now gather indoors with unvaccinated people in one household, again, small groups, unless those unvaccinated people would have medical conditions that may predispose to them having a increased risk of severe illness from COVID. Now, of course, if you've been around someone with COVID once you've been vaccinated, they kind of loosen the restrictions. You don't necessarily have to be quarantined or get tested, only unless you maybe live in a group setting or with other people who are unvaccinated, and of course, if you start having symptoms. Now, mind you, in the rare instances where someone still gets COVID after they've been vaccinated, they're less likely to die or need hospitalization. The infection may not be as severe, but you still, they're recommending not to do the big gatherings. This one's an area of debate. The CDC was cautioning against, travel and, of course, international travel. Some other public health officials have been a little reticent to completely, agree with that. They think they can be a little more relaxed, but I do understand the CDC's caution, because right now with the vaccine and all the talk, they're very concerned about super spreader events about to take place with these spring breaks. Yes, we spring breakers out there, right? So again, things have changed, but we still want to be careful and be considerate of others who may not have been vaccinated.
Thank you so much.
Mm-hmm.
Thank you. That information, I'm sure everybody really wanted to know about, because once you get vaccinated, you want to know, okay, I'm vaccinated, now what? And but we're running out of time now, but I really appreciate everybody who has come on today. Thank you so much. Thank you, Clarence and Tonya and Monique. And thank you so much, Dr. McWilliams. I'm sure that you've answered a lot of questions that a lot of people have. And so again, thank you so much. And what I like to say is, don't hesitate, vaccinate, because right now it's just important. And I know there's still a lot of people who are hesitant. There's still a lot of people who are on the fence. There's still a lot of people who are saying, no, I want to wait and see. But what I'm encouraged by is that there are so many people, though, who have made the decision to get the vaccine. And that's definitely a step in the right direction. So thank you all. Well, Vanetta, I found that to be extremely informative.
It was. I enjoyed everyone's point of view. I mean, because you feel so emboldened in your own. So it's nice to hear others. And that doctor brought it home. He just brought it home.
Yes, he did. He really did. And I hope that other people can see this. If you have any hesitancy, hopefully this has helped you to make a decision about whether or not you're going to get the vaccine. If you want to get the vaccine, if you want more information, you can dial 211 to get more information about the coronavirus, or you could go to gettheshot.coronavirus.ohio.gov, or you can Google any other information that you may need to get. And please remember, if you enjoyed this segment or if you enjoy the show just in general, please don't forget to like and subscribe to the show. And thank you so much, Vanetta.
Thank you. Bye-bye, everyone.
And we'll see everyone next time for another episode of Public Opinion, because everybody's entitled to their own opinion.